Hi, everyone. I'm Jeralise Diaz with the Record Journal. We're here with our new weekly segment, Ask the Expert, in partnership with Hartford Healthcare's Midstate Medical Center, Community Health Center, the United Way of Meriden and Wallingford, the Spanish Community of Wallingford, the State of Connecticut, and the Connecticut Department of Public Health. We'll talk about various aspects of the vaccine rollout and have a medical expert answer a weekly question. Today, I'm joined by Dr. Henry Anyimadu, Hartford Healthcare's infectious disease specialist. This week's question is, why is there a waiting period between the two shots? Is the window to get the second shot flexible?
The truth is, the messenger RNA vaccines are given as 2 doses. And usually it's for Pfizer, it's 3 weeks apart. And for the Moderna, it's 4 weeks apart. When most people think about the dosing intervals, the first thing that comes to mind is that it's arbitrary. But the truth is, this is not arbitrary at all. The dosing interval is because of well-researched scientific process that has informed that decision. So as you know, the first dose is a primer dose. So what it does is that it recruits the antibodies, recruits the T cells, the macrophages, all being the immune cells that would respond and protect someone should they be exposed to the SARS-CoV-2 virus itself. So the first dose is sort of a primer. It primes the immune system and it gets it ready. But that period between the first and the second dose is when you get some or all of these immune cells being recruited. It's just like training soldiers. You train them and get them ready for battle. So you recruit all of these T cells and antibodies and macrophages, and then you give a booster dose. For Pfizer, you give it at 3 weeks, and for Moderna, you give it at 4 weeks. So when you give that booster dose, it sort of boosts up the level of the antibodies and the macrophages and the T cells so that you'll be optimally protected when you get exposed to the virus.
Thank you, Dr. Henry Anyimadu, for joining us today, and thank you all for watching. Tune in next week for our next Ask the Expert. If you have a question you would like answered, leave it in the comments below, and we'll add it to our list. Thank you again to our partners for making this possible: Hartford Healthcare's Midstate Medical Center, Community Health Center, the United Way of Meriden and Wallingford, the Spanish Community of Wallingford, the State of Connecticut, and the Connecticut Department of Public Health.